And another important thing for breast health is actually touch them. Like, not just if you have a partner or if your partner is turned on by breast, no, but you touch your breast. I mean, every day before you go to bed, if you really want to do something serious for breast health, you could every day after you remove your bra or before going to bed, you could put some oils on your breast and just softly massage them so that toxins are moving, the lymphatic system is moving. There's a tension giving to your breast, not just for breastfeeding or for, more related with sexuality, but really just like giving some love to that part of your body, which we tend to hide or we tend to overexpose, or like there's a lot going on around breast in terms of like energetically and emotionally and just like socially. um and as I speak about that, I feel a little bit like talking about the emotional part. um Breast cancer, in general, cancer, if you look at the emotional aspect, and again, everybody's different, so that's theory, does not mean it applies to everybody. Like, you could have this process and say, no, that has nothing, I really don't align with this, and like, that's good, this is just in order to give you a little bit of direction, and where you could go with this information. But breast, no, cancer in general, people with, they call it type C personality, will tend to develop cancer more than other types of personality. A type C is a very compassionate, we could say maybe more like empathetic, submissive sometimes. They tend not to be the leaders, but more the caregivers. It's the type of personalities that will tend to develop cancer in their life. So it's really important when you're in the process of like taking care of yourself or healing or making sure you don't want to go into this direction, to express, like really express what's there for you. That does not mean being aggressive about it, but really, set clear boundaries, express if you're not okay with something. You're acting like this, you're telling me this, I don't feel comfortable. Like, instead of just like taking it in and staying silent. So that's one thing that can help the your health in general, is just to authentic communication and expression. I give family constellation therapy, and from a point of view of family constellation, the process of cancer in general is something bigger than us that we're not acknowledging, or that we are not giving the recognition it deserves. So I have many many examples. I gave family constellation to cancer patient in the hospital, so I could talk about many examples of this. It could be, for example, if my parent had an abortion before me, so this child comes first, and so I'm not really the number one, I'm the number two, and that can be enough to create a pattern of me not giving space to something that's bigger than me. In this case, in this example, it's an older sibling. It can be many things, but this is just like general guidelines. And for breast cancer specifically, the dynamic that Bert Hellinger was talking about is, I'd rather die than bow to you, mother. hmm So I'd rather go than just have this humble posture in front of you, mom. Yeah, I feel like letting it sink in. No, again, um, the mother is bigger than us. No, so there's that dynamic, and sometimes it can be a very subtle arrogance. It can be an arrogance that's expressed by saying, I'll carry this, whatever load, whatever issue, no, that your mom had. Maybe my mom was raised in a lot of poverty, and I, on a soul level, chose to carry it for her. And I'll say, I'll carry it for you. Or maybe she had a lot of losses. I'll take this for you. So it's from a good place, but really, our parents are bigger than us. They came before us. They have more knowledge, more wisdom than us. They just have more life than us. Like, so no, they can carry their stuff. And then I can carry my stuff, which makes me available to turn toward my own kids and see them, and not create this chain, no, this legacy of taking care of our parents. So that's a subtle arrogance that we have. And then there's a more open arrogance of when there's like an open conflict. Oh, my mom is this and that and this, then that's a dynamic that can promote, that would need to be explored. I'm careful of my words. That would need to be explored with somebody that has breast cancer. And I was going into direction, but I just became blank. So I think maybe something I was not supposed to say. So there's a lot to explore emotionally and energetically in terms of breast cancer and breast health. And if ever you need to explore more this area, I can support you. Or there's even just somebody that do psychotherapy. Um, there's maybe I'll do a video about things that can be done at home to support a healthy emotional expression.